Okay, today is August 13th. We're here with Wayne again. Wayne was on my YouTube channel a while ago because you had angina that got dramatically better. Is that correct?
That is correct. Originally, I was walking a block and then having to stop and walk another block and stop. Then after two treatments, I could walk several blocks before I had to stop. But I haven't had, since the course of treatment at that time, I haven't had any recurrence. Now my exercise tolerance is essentially unlimited.
It's unlimited. Well, that's pretty good. Now, that's not why we're here today.
No.
We're here today because you came down here. You lived in the area before, but now you live in Washington.
Right.
And you came all the way down from the Seattle area for me to treat your prostate.
Correct.
And you have prostate cancer. And you were having some symptoms in your prostate before you started with us this time. And for the viewer, you have been rather stable with us for many years, correct?
Yes. In fact, it wasn't until shortly after, around the time I moved up to Washington, that my PSA began to rise again. And so I checked out someone I thought in an alternative clinic there, but unfortunately Jonathan Wright couldn't see me because of his problems with the medical board
Great.
again. And so the ND I saw gave me something to try, and it didn't work, and my PSA went up more, and he says, oh, well, this is more serious, and you need to get conventional treatment. And he sent me to see someone, and after talking to that fellow twice and doing some more other research, I decided I really don't like this, and so I called up you on the phone, and we had a consultation, and after talking to you, I felt about 1,000% more relieved because the statistics that they give you are very misleading, and after you ask a few more questions and keep digging, you find out that the side effects of all conventional therapies are horrible, and the statistics grossly understate them.
In fact, I just got off the phone with a telephone consult on a man who had prostate cancer. They did a radical prostatectomy, and now he has to go to the bathroom every 30 minutes.
Yeah.
And he begged me, can you do anything? Be honest with you, I don't know what I can do after you take your prostate out. Anyway, you were having prostate symptoms before you came. We want to tell the viewer what you were experiencing and what's happened?
Yes. How long before? Maybe a month or so before I actually drove down here, I started getting symptoms in the form of little sharp pain. Well, I also had the discomfort, I would describe it, in the area. And then I developed sharp pains which occur occasionally. I thought, this is really going downhill. And so when I came to see you, the first thing, the first day, and you gave me a prostate injection, that stopped the sharp pains. The sharp pains, I haven't had a single one since that first injection.
Now, for the viewer, the injection was taking your own blood, ozonating it,
Yeah.
and giving it back by an injection towards your prostate. Did it hurt?
Not much. It hurt a little bit. You get a needle stick going in, and then when you hit the prostate, you get another one that's maybe a little stronger than that. I would say that I've had 4 now, and the first one was the worst in terms of the pain going in, but it wasn't that horrible. And the other 3 were noticeably less than the first one. I can only speculate that my prostate was more sensitive at that time.
Right. And what's happened then since we started that then?
Well, as I said, after the first treatment, the sharp pains disappeared and never came back, and the feeling of discomfort that I was feeling constantly became intermittent, and now seems to be gone completely. After 4 treatments.
After 4 sessions.
Over a period of about 2 weeks.
Okay. I'm really happy about that. I guess you're happy you came back down.
Oh, I am. I'm glad I decided to call you and get your telephone consult. I will tell you, after talking to you emotionally, I felt so much more relieved because I was facing several bad choices, and now I have a good choice.
Okay. Now, I want the viewer to know, I did not promise you anything, did I?
No.
And I've never promised you that I can cure cancer.
No. In fact, you didn't say that you were treating cancer. You said you were treating me. You were treating my body's immune system.
Exactly. That's our philosophy here, Wayne. Thank you for saying that. I don't treat cancer.
Right.
I don't believe in that. I believe that the answer, if there is an answer to cancer, it's not to treat the cancer, it's to treat you.
Yes.
And if your immune system comes alive and can see the problem, it will fix it. That sound fair?
It does. You obviously know what you're talking about.
Same thing with heart disease too. If we can get your body to do what it's designed to do, then heart disease, in my experience, has been really a piece of cake. So we've seen that with you, and my prayers are with you. This is the last time I'll see you this trip, but obviously if you need me, you'll let me know.
I will.
And for the viewer, your PSA was stable for several years.
Yes.
Then only in the last 6 months or so, I think that's when you saw it rise. And that
Yes.
was long after you moved out of this area and got away from me, correct?
Correct.
All right. Thank you so much, Wayne. I may post this on YouTube again?
You may.
Thank you.